Hi everyone. It's been a few days since we haven't updated you on what's going on in our clinic, although you must have heard already and seen on our webpage. We are happy to announce that we are reopening the clinic. We are reopening the clinic and starting on May the 5th. Look, just to go back and explain a little bit of the situation that we were in. We had been told at the beginning by the European Society of Human Reproduction to please not get more patients pregnant. We had spoken about not having enough data to make sure that pregnancy during this pandemic was safe. Newer data is showing that pregnancy doesn't seem to be a risk situation, and also the amount of patients that we as clinics were getting pregnant was not a substantial number in comparison to natural pregnancy, especially here in Ireland. So all the clinics and the majority of fertility societies positioned in favor of performing treatments to get patients pregnant. And finally, thank God, here we received communications on April 23rd from the European Society that we could proceed and perform transfers on patients, inseminations, essentially getting women pregnant. So we're happy to announce that we will be starting and we'll be getting back to normal. Now, of course, this is going to have to be a very progressive process. We will be starting prioritizing patients with poorer um, fertility prognosis, patients that are in the older age and with lower AMH, patients that could be qualified as having more urgency for their treatment. This will be to free from the backlog of patients that were canceled in the previous couple of months and patients that couldn't start treatment. So we're going to have to please ask understanding to the rest of our patients. This will be something that will probably take 1, maximum 2 months, and we will be resuming treatments for the rest of our patients very, very shortly. We will also start with a diagnosis for these patients that have been having online consultations or that were pending diagnostics previous to closing up the clinic. We will be starting with that too very shortly. We will be doing this in a very progressive manner. Guys, please remember, this is our first pandemic too, so there will be a learning curve for us. We're going to start with very small numbers to try to keep all the recommendations of social distancing. All the personnel that will be in direct contact with patients will be wearing PPE, but we want to please ask you guys for your collaboration and your understanding. We are going to sadly ask husbands not to be with their partners throughout this process, to try to keep the number of people in the clinic as minimum as possible, to reduce the risks of anybody passing this disease to anybody else, to respect the recommendations of the HSC in regards to social distancing. So husbands, please, we're going to ask you if you can please wait in the car, and as soon as the patient is discharged, you can come up and collect her. We're also going to be asking for extreme punctuality. We do not want to have too many patients in our waiting room. So we're going to please ask all of you to be on time. We will certainly do our very best to be on time too. And we're also going to ask you for understanding that consultations will now have to be a lot shorter than they normally are. We are not cutting down on information given, but we will be giving you a lot more information with online consultations, online nursing. All our new patients, all our review consultations will have to be on the phone or via Zoom. All this with the idea of keeping number of people inside the clinic as minimum as possible. We want to resume our treatments. We want to get you guys pregnant in the safest possible way, but safe for you guys, but also safe for us. Um, I hope to see you guys really soon. I'm very happy about this news, and we'll get to chat in person very nearly. Okay. Have a beautiful day, guys. Stay safe, and I'll see you.